you're getting some sciatic nerve pain that feels like it's just a big, deep ache or pain in the glute, this is for you. So you can lie down on your back. So you're gonna lengthen out the leg that's not bothering you, and then you're gonna bend the knee that is, and then plant the foot. And you're just going to slowly, very slowly, lean the knee over to the opposite side. And then you're going to take your hand and just make a fist and put it underneath your hip. And then you're going to very slowly pull the knee towards the outside. And you're going to feel something hard, most likely, and it'll be a little bit tender or achy. And you're just going to hold this pressure here. So this is where the nerve can get stuck right behind the hip joint. And there's a muscle that attaches from the sacrum to the back of the hip joint there. And the sciatic nerve can pass over it, through it, or under it. So we really want to loosen up this kind of connective tissue muscle bundle that is from the muscle into the tendon that attaches to the back of the hip. So you're just gonna keep holding your fist there with your knee out to the side until you feel that pain start to release or the tissue start to soften up a little bit. And if it's painful for you to use your fist, you can use a ball or something hard to get that pressure there. I like to use the fist because the knuckle gives that perfect, like specific pressure into that little bundle. So you can just hold there and you'll feel the front of the hip start to open and relax, and try as much as you can to let your body soften. And I know it's such a painful area to work on, but it will make a big, big difference. So once you start to feel that soften and relax a little bit more, you can start to lift the knee up and then drop the knee back down. Just very slowly. It doesn't need to be a big lift at all, but this is just going to help you massage into that little bundle after it's been relaxed from the steady pressure. So you can continue doing that until you feel that little bundle start to soften, or you feel a decrease in tenderness or pain there. And you can feel free to do this on the other side, even if it's not bothering you. Most likely you'll find some things to work on, maybe not as much as the problematic side, but you'll still find some juicy things to work out. So you should feel that area start to soften and the glutes start to relax a little bit more. And then you can just hold where you feel it the most through that motion. Maybe the knee's up a little bit, maybe it's a little bit further down. And then you can repeat that process by lifting up the knee and then putting the fist slightly lower just to get a different angle through the back of the hip. You'll find another juicy spot most likely where that nerve is passing through. So you can hold that steady pressure until you feel it start to relax a little bit. And then you can start to add that gentle movement. If you feel the gentle movement feels better than just holding it still in that compression, then feel free to go and do that. The connective tissue starts to get really matted down in these areas where there's overuse, like repetitive motion kind of things, or simply because it's not being used enough. So we really want to start to break down that area and start to loosen up those fibers so we can get more blood flow, because blood is the truest healer. When things are just so congested, fresh blood can't get in there and everything gets sticky and angry. The nerves want nothing more than to be able to slide and glide. So we want to loosen up all the fascia, the connective tissue, and those muscles, those tendons, so that we can let more blood flow in. And after doing that, you can lift up the knee and notice how you feel. You should feel a decrease in those symptoms. You can move the hand up, that fist up a little bit if you want to try a little bit higher to get in through more of the glute. And then you're no longer really working through the back of the hip, you're just working through the glute medius. So you can add some compression with that knee out to the side to get into that area, and then just let the glute slowly relax. This is one of the muscles that tends to be a little bit weaker and can contribute to the pain. So we really want to strengthen that muscle, which I'll show you in a second. So then you can, after doing the steady compression, you can lift and lower the knee to relax those fibers a little bit more. And then once that's feeling better, you can drop the knee towards the inside. And just notice how you feel. You should feel a little bit of a stretch. And if it feels okay for you to do so, you can lift the knee up. So by lifting the foot off the ground, and just have a gentle pull towards the opposite side. And just take 3 long deep breaths there. Then you can drop the foot down, lift up the opposite knee, plant the foot, and then cross the foot that's affected, that leg that's affected, on top of the other knee, and just gently push the thigh away from your body. And that's gonna stretch through the hip flexor on the right side, but it's also gonna stretch through the glute. So you're just going to hold that and take some steady deep breaths and try to relax as much as you can. Breathe from your belly and exhale fully out your nose or out your mouth. So you can place a hand on your belly to make sure that you're breathing from the belly, so your hand rises when you take a deep breath in. And then slowly, very, very slowly and gently, move your body to the opposite side of the leg that's affected. And stop where if you have any pain, and just back up until when you're on the brink of having pain. Otherwise, you can continue all the way down, nice and slowly, dropping the leg down to the opposite side. And here you're gonna feel a stretch through the glutes, and you're just gonna push the leg gently away from you. And take a deep breath. Beautiful job. Taking at least 3 deep breaths here. Okay, and then you can slowly lift back up. So you can stay there for a longer period of time if you wish. If that's not feeling good, here's a variation that you can do, is lengthen out the opposite leg and then turn towards the side that is feeling good, the opposite side, and then extend your leg out long. And this is gonna stretch in a different way through the glute, but also through the IT band, and it's gonna hit that sciatic nerve line. So if the other one really isn't feeling good, try this one. Breathing deeply and exhaling fully. If any of these are feeling too painful, sharp shooting pain, stop and don't continue, but it should start to feel like it's loosening up. If the nerve is stuck in the glute area and not coming from higher up through the lower back. And taking at least 3 long, deep breaths here. And then bend the knee and then straighten the leg. You can glide it along the floor to do this. Bend the knee and straighten the leg. And this should feel very nice. And if it doesn't, then stop, but you should feel a really nice and pleasant stretching sensation. And do this several times, maybe 15 times or so, as long as it's feeling good and juicy. And wherever you feel the most stretch, of that juicy, feeling good stretch, just hold that. Most likely it's with your leg completely straight. And take 3 long, deep breaths there. If you like, you can strum the side of the glute there as you're taking your breaths. And then you can bend the knee, roll back on your back, and plant the foot back on the ground. Bend the other knee, and then send both of your legs to the side as you roll to the side. And now we'll strengthen through the glute medius. So knees are bent, not too much, but just a little bit. Then you're going to separate the knees just a little bit. So you can have probably a fist and a half between your knees. And then you're going to lift your foot up and then flare your foot to the side, like flicking your pinky edge of the toe up. And you're just going to hold that. So you want to hold that for a good 30 seconds. And this is going to strengthen your glute medius here, which often gets weak and contributes to this whole sciatic area. So we're just going to hold this for 30 seconds. You should feel it through the side of the glute here, and you can tap it as well to help wake up those muscles. And if you start to feel shaky, that's completely normal. Beautiful job. So after a good 30 seconds of that, you can take a 20-second rest and repeat that 2 more times. And if you're not feeling it too much yet from that exercise, which you probably are feeling it, but if you want to take it up a notch and you're not like extremely sore, you can feel the muscle activating and you're already feeling like you have less pain, then you can kick the leg in a backwards motion and then come back to that original position. So kick out to the side and up, and then come back to the original position. And you can do that around 10 times. So you can choose whatever variation you prefer, whether that's just the clamshell hold, or you can do the clamshell hold and then the kick, or just the kick. Do whatever feels best for you in your body. I like to do a combination of both because I feel that really gets the glute medius working, and it strengthens around the hip to take pressure off the hip joint so that muscle can be strong, so you don't need all those connective tissue bundles created for support. The body is always laying down connective tissue wherever it thinks it doesn't have enough support or strength. So we want to build that area up so it doesn't need to do that. So after doing that 12 times, you can take a rest, and then you can repeat that 2 more times each. Okay, thanks. So hopefully that has you feeling a little bit better, and I'm going to show you one last move that will help if there's something going on in the lower back that's contributing to the situation, because the sciatic nerve does begin from the lower back. So you can take your hands by your ribs and then slowly lift up and then come back down. And only lift up as much as you can without pain. And then slowly come back down. And you can do this a good 12 to 15 times. And you can do that several times a day, 3 times a day, to help get the spine moving and to allow those nerves to relax. I hope that helps you. Let us know in the comments if it did, and if you'd like more tips for these types of symptoms. So have a great day, and we'll see you very soon. And you can do this twice a day if you need to. The exercise itself, that part, you can do it just once a day, and that will really help strengthen and support the hip. But as for the areas where we were just compressing it, then doing some range of motion to get into the connective tissue and muscles, you can do that several times a day, as much as you need to. But you should feel like you have a softening in the area and you feel like it's been worked on, and that's a good sign that it's on the way to feeling better. And I'm going to show you